Hello everyone, myself R.Vinodhini, working as an assistant professor in the Department of Biomedical Engineering, Bharat Institute of Higher Education and Research. I'm handling the subject Medical Informatics. Today we are going to discuss about the topic Computer-Based Patient Record. We simply call it as CPR. We'll see about the contents in this CPR. First, we'll see the definition for this CPR, computer-based patient record. It is a repository of electronically maintained information about individual's lifetime, health status, and healthcare stored such that it can serve multiple legitimate uses of the record. So, if a person is having any health issues, their health status has been keep on monitored till the entire lifetime, till his entire lifetime, his health status has been keep on monitored. So whenever he needs the data about his health condition, he can able to get it easily. So this is the main concept of this computer based medical record. So hospitals now these days they'll be using an excel sheets, right, to maintain the various patients details like patient information, in which ward they have been stayed, then their bed number, billing details, everything they will be saved in their excel sheet. And manual operation will be quite less here when compared to the details what they have been manually added. It is quite easier way to record their details, patients details. And also number of patients details that are stored in a single excel sheet is limited. So if they will be having a in a ward, they will be having many number of patients, right? So if they open one excel sheet, they will be having a complete entire detail of that single ward. So that is also the main thing in this computer-based patient record. And searching for information with respect to certain criteria could be difficult. So if it is a paper-based recording system, see, a particular patient's information we cannot able to get it quickly, right? Whereas if it is fully computer-based, means what will happen? If you search the key point itself, it will show all the related terms and conditions, terms, right? So in such case, this will be a more useful to all the staff members working in an hospital. And data stored in those Excel sheet is sometimes not very much secure also. If we want to maintain more than one copy of this Excel sheet, that may be inconsistency. It is if you want to copy the Excel sheet repeatedly, sometimes it may be leads to some other malfunctions. So that is what they are telling here. And if you want to use a database to provide the required details instead of using an Excel sheet, so they'll be having a special database for this record system. So they will be having a particular software to maintain all the data of a patient. If they're using an Excel sheet, what will happen? Sometimes it may collaborate or anything may happen, right? So in such case, they will be using this database softwares to provide the all to provide entire details of the patients. Then will and also the information regarding the patients can be stored in the database itself, and it can be update the table field. So whenever they want to update their patients health condition or their data, it will be updated easily in the state of databases. So they can be update like the patient's details, amount of the bill he has to be paid, and what about the balance billing details, the ward number, the bed number, and the registered number. So once if he admitted, they will be giving a registered registration number also. So that registration number they will be stored here, and the case number. So what kind of case they will be having. So all those things they will be updated in that database itself. So as soon as the new patient is admitted, they will be collecting all these details. So this is the main thing here. And also they will be entering the ward number for the patients either in the general ward or the ICU. So if they it is specify about the ward number, they will be specifying about whether he is staying in the general ward or he has been staying in the normal ICU. So if it comes in a critical state, you will be directly sent to the ICU, right? So that information also they will be sent. And then settle all bills pending to be paid by patients before the patient's discharge. So before the patients get discharged, they will be getting a information of this billing status. So while discharging they have to clear all their bills, right? So in such cases this billing also will be notified in the database itself. And they keep on tracking about the beds occupied. So what are all the how much beds were there in a single ward, is that fully occupied, or we can add one more patient or two more patients. So that thing also they can track in the databases. And then later on both in the normal ward and in the ICU one, they will be tracking this bit occupied. And they will be keeping a track for all the transfer of patients from the general ward to the ICU and vice versa. So if the patient is admitted in general ward, later on if we move to ICU, that database also mentioned. Same way, if the patient first admitted in the ICU and later on you have if you want to shift from ICU to general ward, those data are also recorded here. Then they will be having a clear detailed information of the patients, their admission time, when the amount last billing amount he has been paid. If it includes the billing amount, all the departments it will be having, like a bed charge, pharmacy, and then some radiological scan amount. So all those things will be mentioned there based on the treatment they are being undergone. So this system can be used by only team members and also administrator of a particular hospital. So only the specified person can able to use the system. It will be fully secured mainly. So the database can be used by team members in order to search, edit, and also the add patients data. So only the specified team members can able to update the database. Like it's not like simply anyone can able to update their records, not like that. So it is fully secured only. So in order to search, edit, and or else add the new patients data, only the team members, only the particular specified person can able to update all. Then the database can be accessed only after installing the software on the local system. So when it will able to accessed only after installing the softwares on their local system. And this softwares can be used by only one by a single user at any instant. So as they will be having that much like they will be having that much specific security to the databases. So only one person can able to use a particular data. And the system's usage is confined to use by single usage by single organization. So if a software is used, it has been circulated to a single organization. So the whole hospital in all the departments. So if you take a hospital, it will be having a various departments, like so all the departments will be having the um, all the departments will be having this data software. And we'll see about the functions. So this system should add the details along with the automatically generated register numbers of newly admitted patients to the databases. And the system should search for existing patient detail for a given registration. And also this system should keep the track of vacant and occupied beds in general ward and ICU. So I told you before itself, right? So this data system will be having an entire detail of the patient. So starting from the registration number, if the patient is going to admit in a hospital, they'll be giving a registration number. So from the registration number, they'll be starting to enter the patient's data of a newly admitted patient. Then if they want to search existing patients or already admitted patients, if you want to check any details, in such cases what will happen is the system should search for an existing patient detail also. For if they all will providing a registration number, right? So with the registration number itself, they'll be getting the patients, the entire detail of the patient they'll be getting. And then the system should keep the track of vacant and occupied beds in general ward and ICU. So it is not about the patient thing, it is a general search. So in which ward, how many beds were free, how many beds were occupied, all these status also will be updated there. And if you see, uh, you'll be having a usability, availability, accuracy, and also access reliability. So usability, if you take, the system should be user friendly and also self-explanatory. It should not be difficult to handle. If it is not to be difficult to handle for a doctor or a team members in that hospital. So it has to be a very much very simple software, and also it has a self-explanatory thing. So that is the usability and availability. If we go for the availability, the system should be available 100% for the user, and it is used 24 hours a day. So there should not be any lack in that availability. It has to be work for 24 into 7. Why? Because in hospital it will be always in an emergency. What will be there, in at any time the patient can come and admit, right, in an emergency situation. So that case, this software has to be like fully available 24 into 7. It has to be available. So that is the availability. And accuracy. So if we move on to the accuracy of the system, it should be limited by the accuracy of the speed at which the user of the system uses. So accuracy will be limited of by the accuracy of the speed. By the speed it can be measured, its accuracy you can able to measure it. It will be quickly able to update, right? So there itself you can able to know about its accuracy. And then access reliability. So this system shall provide a 100% access reliability, so it can be easily reliable to the users. So that is the main concept here. So we have seen about usability, availability, accuracy, and access reliability. And see, look at this block diagram. It is an entity relationship diagram. How the patient has been receiving for both inpatient and outpatient, they will be managing the um, data. Okay, so if it is for the first, we'll tell about the outpatients. So if it is for the outpatient, what they'll be having the patient ID, name, and history. So if the patient wants to consult any particular specified doctor, they'll be given a patient ID, and they'll be registered the name and also history. So for what purpose he is going to consult a doctor, consult a physician, they'll be taken. So they'll be taken the data, and it will be recorded. They'll be recorded. After that, what will happen? It will be stored in the database, patients record database, and all these things will be managed by the system administrator only, right? So if it is for the outpatient, they will be giving the patient ID, their name, and their district. So for what purpose they has been come to consult the doctor. So specify the they'll be specify the diagnosis thing, right? So what kind of treatment they want to take from the doctor. So that thing they'll be mentioned. So after that, they'll be stored the database, patients database. So all these things will be managed by the system administrator in a hospital. And if it is for the inpatients, what they will take, they'll be having the patient ID, the name, extra two things they will be adding here: ward number and the bed number. So at which ward and which bed they will be going to admit. So all those things they will be taken. So patient's ID, name, ward number, bed number, history, everything they will be taken. And same thing, they'll be again records are being saved in the database, and it all these things will be managed by the system administrator. So this is what about the entire relationship. Then it will be having about three levels. So first, level 0. So here what they will happen, patients record database. So here in the patient record database, they will be store the patient's data here. So once the patients come here, what they will be storing the patient data entirely, and it will be get viewed by the system administrator. And from the system administrator, if any updated thing is needed, they will be updated in that database, and it is again get viewed by the patients. So if the patient have that entire have a specified user ID for this treatment, they will be able to search in that database. So all the medical all the like medical related doubts they can able to clear in its detail, entire detail. So everything will be updated in the database, right? So it is easy for the patient to uh, get a view, or can able to know about their problem, etc. So this is what about level 0. It is about the patient record database. Then this is level 1, where the patients how they will be getting the patients will be received by the receptionist. So there only the receptionist work only like taking the patient's history and the stores record. So in the hospital, if the receptionist duty, it is the responsible for the receptionist to take the history of the patients and also store the data in the database. And after that, if it is for the indoor patients, they'll be after getting the ST, they'll be allocating the ward number, bed number, and also they'll be giving the registration number also in the reception itself, right? So if it is for the outpatients, the same thing will be done, but only they will be specifying the doctor's name uh, and their history. That's it for the outpatient. Whereas in inpatients, what will happen? They will be giving the they will be allocating the ward number or also bed numbers to the patients. But for both the patients, they will be giving the patient ID. And if it is for the indoor patient, they will be giving the register number also for the patients. So if you see the diagram, you can able to understand it. Patient which is received by the receptionist, they will be take the patient's history and also stores the and also they'll be store their record store their history, and it will be managed by the patient. Same way, if it is for the indoor patient, the patients they'll be entering the entire database of the patient, and it will they'll be allocating the ward number and also the bed number, right? So this is what about level 2, and we'll move on to the level 3. Sorry, level 2. So here so there how for the inpatient and outpatient, what are all the things they are going to do, that's about level 2. So from managed patients, it has been branched into 4 different parts, right? So here, add patient, search patient, make bills, show free beds in the wards and ICU. This is for all this thing for both inpatients and the outpatient, mostly for the inpatients. So they'll be first, if the patient got going to admit in an hospital, they'll be tracking the free beds, whether the free beds they're available or what. So the thing they will be tracked. So the database will be showing the free beds in the ward and also the ICU. And after that, what they will do, allocate the free beds to the new indoor patients. So after allocating the free bed, they will be allocate the ward number, bed number, and to the patient, and also they will be enter into the software. After that, add a new indoor and the outdoor patient informations. So their information, their age, their sex, for what reason they have come to the hospital, if they are going to admit in the hospital, so what disease is be having or disorder, anything, right? So all those details will be mentioned here. First they will be looking for a free ward and the free beds in the ward, and then they'll be adding the patient's info. All the infos will be added And if after allocation of the new bed, they if it is for the outpatients, directly they will be adding the patient info alone. Whereas if it is in the indoor patients, first they will search for the they will be searching for the free beds in the ward, and after that only they will be enter the patient's info. After that only they will be getting the patient's info. Then it will be moved to the search patient. So after if he admitted in the hospital, they'll be search in between. If any doubts they will be having, they will be clear by using the search data itself. So they'll there what are all the things they will look: view patients, registration number, name, date, discharge date, admission date, history, treatments, bills. So all those things will be search can able to search. So view patients details. So in the view patients details, they will be they can able to search the patient's details, and also they view the almost from top to bottom they'll be having the entire detail, like view patient, registration number, name, date, admitted history, treatment bills. So all those things they can able to search in the view patient's detail. And after that, after every treatment gone over, he has to get discharged. At that case, make bills option will be there. So there amount to be paid based on the treatment given or ward selected. So they'll be seeing for the amount to be based on the treatment. So what kind of treatment he undergone, and also what ward. If it is in a hospital itself, they'll be having a separate ward, separate room for the patients, right? So based upon that thing, they'll be making a bill. After that, all those things will be shown in the patient's info. So it starts from the main age patients, and they'll be first they'll be looking into for the free beds, and they'll be adding a patient information. And if it is inpatients, they'll be searching for the details. What kind of details it may be, everything it has to be updated in the database, right? So like patient's registration number, name, date, discharge, and then a date of admitted, history, the treatments, what kind of treatments he is been undergone, and then medical details, like pharmacy details, and then at the stage of discharging, they'll be having a patient billing status details. So everything will be there. And see, look at this diagram. So if it is log into the system, new patients will be there. They'll be asking for a patient's detail. So like there they'll be taking the patient info, name, age, sex, what kind of treatment you want to take. So all those things. And after that, if it is for the indoor patient, they'll be for both indoor and outdoor patients, they'll be allocating the register numbers, right? So if it is for the outdoor patients, first the treatment has to be paid, sorry, first the fees has to be paid, then only they will be consulted doctor, specified doctor, right? After that the treatment should will start there. So that when once the doctor gives the treatment to the patients can able to leave, then the patient's detail added to the database, and it will be update, the database will be updated. So it all these things will be managed by the system administrator in the hospital, right? So this is for the outpatient. So first, if the entry of the patient, then they will be taking in patient information. After that, they will allocate a register number for the outpatient. Then they will be asked to pay the fees based upon the doctors. And after that, the treatment will be start. Then the patients can able to leave. After leaving before leaving the patient's entire data will be stored in the database. This is for the outdoor patients. Patient. And one more block diagram is there. So the same thing only come till the allocation of register number. Till the register number allocation, outdoor patient and indoor patient process will be same only. After that, if it is for the indoor patient, they'll be leads to the allocation of bed and the ward number. So before allocation, they will be search for the free beds in the particular ward. So what in which ward he has to stay. So there they will be checking the bed free beds. After that they'll be start receiving the treatments. Then how many months or the days it may go, but they will be keep on recording all those necessary information. So they will be receiving the receive the treatment. Once the treatments got completed, yeah, the patient has to get discharged, right? At that stage they will be checking for their billing status. So once the billing is get cleared in the database, then only the patient can able to leave the hospital. So they'll be checking the billing status of the patient, and all if the all bills are cleared, what will happen? The patients get discharged. So the patient's details will be added to the database again. So at last, after getting discharged, the patient's detail will be added to the database, and it will be stored, right? The same thing only. So it will be starts from a new patient, then they'll be taking an information of the patient. They here it has been split into two: outdoor patient and the indoor patient. If it is for the outdoor patient, if after he paid the fees for the respective doctor, they'll start his treatment, and after he can leave, he can then leave, and it's and their data will be stored in this database. So if it is for the indoor patients, before after giving the registration number, they will be search for an and they'll be search for an free beds in a ward and allocate the bed number and the ward number. Then you will be start receiving the treatment. Once the treatment got over, after paying the bills, he can able to discharge. So till that every details will be noted down, and all will be updated in the database. So this is what about the patient's data. So today we have seen about the computer-based patient's record, how the software has been implemented to store all the necessary data of the patient, how it has been stored to his entire um, entire treatment process till the its lifetime. They can able to see or see their treatment stages, treatment details, everything they can able to see using this software. So this is the main important thing in this computer based patient's record system. So whenever the patient need the data, they can able to easily search through this software. So this is the important thing.